See, we started the program by talking about beauty standards. Are we obsessed? Is it a form of oppression? And usually, when we talk about changing one's physical appearance, a particular group of people are pointed and said, it's your fault. If you did not exist, the option will not exist at all. And they are plastic surgeons. We have a brilliant plastic surgeon in the house. He's recognized around the continent. He does great work in reconstructive surgery when it comes to his smile train. But then he also does cosmetic surgery. That's why we have Dr. Sammy Oben with us this morning. You're welcome.
Thank you so much.
Hope you're doing great.
Just coming back from Mali.
Yes.
I'm doing quite fine. And it's quite an honor for me to be here this morning.
It's our honor to have you here. Truly it is. We're here to learn because we may have perceptions, but then you have the reality from your experience. So we want to first of all clear this out. What is plastic surgery? What is cosmetic surgery? So people who don't understand can.
Well, plastic surgery comes from the word plasticos. Plasticos simply means to mold. It's just like you have in plastics, and you want to mold it to give it a form. That's where plastic surgery, the name plastic surgery comes from. Then later on, plastic surgery began to fragment into tiny different sections. We have a people who want to mold to establish function and some kind of form. We call them reconstructive surgeons. I mean, someone is born with a birth defect, like you just mentioned. Children born with cleft lips and palate, and someone born with cleft deformity, with other deformities. The reconstructive surgeon now comes to mold that person to have a good function so that the children can be able to eat well, breathe well, talk well, but also so that they can look well. But the aim of that procedure is reconstructive, it's not cosmetic. But they have some form of cosmetics that is given to them. We also have people who are burnt. They have accidents. They had a lot of damage to their body. This is not congenital, it's acquired. The reconstructive surgeon also comes in with an arsenal of flaps. Flaps as things with, we just kind of beat the body and give that person some kind of a function so that the person can be able to move the hand and eat.
Yes.
The person can be able to walk. The person can be able to reintegrate into the society and do home chores and live a normal life. But they give some kind of cosmetics. So reconstructive surgeon, his focus is reconstruction to have a good function, but some form of cosmetic.
Yes.
Then you now have the people I like, the cosmetic surgeons. They say, well, there is actually no impediment, no disturbance in the function. But the person doesn't just like the way he looks like and is beginning to cause him to have some emotional problems. Well, health is defined by WHO. Part of it is emotion. You must have an emotional stability. You must be stable in the way you think, the way you look at yourself. So they said, well, why don't we fix it? It's not very good. Well, the nose is too flat. It's not fine. Can we reshape the nose? Now, they are reshaping not because of function, but because of cosmetics. But that cosmetics has two things. One, either because the person is emotionally, psychologically affected by that form, or it is the mode of the day. It is the mode of the day. Well, I think it's the mode of the day for a woman to have this curve like this.
So I want it.
So I want it
and
also.
I get it.
And I get it.
Tomorrow it's like this.
Tomorrow
I want
like
it.
This.
So I get it.
So the plastic surgeon goes that way.
Yes.
So the plastic surgeon is there not for some emotional problem.
Yes.
But for some personal desires.
But when does it go wrong?
It goes wrong when you get more than enough. When you get more than enough, when you get something which is out of size. As I tell my cosmetic patients, I said, today you are young, you are beautiful.
Yes.
You want a very big butt, you want a big hip, a big breast. But tomorrow when you get to 70, today your body build can be able to carry that load But when you be 70 and 80, your body build will not be able to carry that load, and it becomes an impediment on you. Therefore, choose correctly.
This interests me.
Eat averagely. Don't overdo it. Because when you overdo it, you will pay for it much later on. Sometimes the girls will say, well, I don't mind now. I just want to get what I want.
We live for today.
I want to live for today. But I warn them of tomorrow. Because that's my duty to do
I loved
that.
what you just said. So we're keen to know what happens when someone comes to you and says, for example, I don't like my nose. I want to change it. What kind of conversation do you have with someone like that?
Well, first, I have to understand why the person wants that nose to be changed. Is it a psychological problem? Is it just a problem of peer pressure? Is it a problem of the social media? I have to go down to the depth to know what that person really wants from that nose. If I understand it's a problem of peer pressure, I sometimes mellow them down. I say, you don't need this. It's funny because I'm a cosmetic surgeon.
Yes.
I need money. But
yes.
I believe from my belief that it's not every time you make money. It is your duty to tell the patient what is important. So I tell the patient, you don't need this. It is not necessary for you. But if I see that, yes, there is actually a psychological problem, there is actually a morphology problem, I will go in and advise. I say, you can have this procedure, but don't over have it. For example, if you want to have a nose job done, don't make your nose to look like that of a white man. No, it's wrong. Your face is that of an African. An African face goes with the African nose. And also, you must also know that the African nose is made that way by God. So that you can breathe well and cool the air. The white man nose is
because of the tropical nature.
The tropical nature. If you have a tropical nose, if you have a temperate nose in a tropical area, then eddy currents on your nose hit the air too much. And you feel bad about it. That's why our noses are flat. But there is something which they call ethnic rhinoplasty. Ethnic rhinoplasty is when you make a nose that looks like an African nose, but also looks like the kind of nose that the patient wants.
So it's somewhere in between.
It's somewhere in between.
That makes me want to know
ethnic rhinoplasty.
The different kinds of procedures most Cameroonians go for.
Well, first and foremost is liposuction. And BBL, having the guitar shape and butts. That is the primary surgeon. I think it's the #1 procedure that I see Cameroonians want. Number one is liposuction.
Liposuction, they want to lose weight.
They want to lose, not losing weight. Plastic surgery is not for losing weight. We don't make people lose weight.
So liposuction.
But we address resistant fat areas. Which have been resistant to dieting, to physical exercises. There are some areas, no matter what you do,
especially women after having a child, and the stomach will not get back to how it was.
I think every woman needs that procedure, including my wife.
Oh wow. Dr. Oben. And then the other one is BBL.
The BBL is the reshaping of the butts. You know, naturally the African woman has nice circle round shaped butts. But not everybody come in that form. People come in square form, people come in flat form, people come in V form, people come in the vertical form, people come in every other form. But beauty, what is accepted as beauty I use today is that curving linear form with good hips and a nice projection behind. It's definitely beautiful. Even if you look at sculptures of past, you see that depicts beauty.
But then, when you say this, I think of what you said earlier. When you talked about the tropical, the temperate. But I also believe that the way we are created, the bones we have within us, are meant to carry a certain form of morphology. That if you temper with it, it could be difficult to handle. Even if you like it, even if it's what is trendy, it could actually hurt the person. What do you think about that, doctor?
I think I should give you an A grade. Because in reshaping the body, one of the things that we consider is the morphology of the bones.
Yeah.
And that's why I say I give you an A grade. But the morphology of the bones, it only affects the shape. It doesn't really affect the way the person will carry on. It is difficult for me to reshape with different morphologies. For example, people that have a straight kind of shape, they are very difficult to form than people that have this kind of shape.
Yes.
So you see, the morphology will affect the number of times I need to operate this patient to get the patient to where the patient wants to go to. But it doesn't really affect how the patient is going to live. Yeah, it doesn't. Except the person has some kind of a gait. It means the person is walking and is not walking very well. So except the person has some kind of a gait. But the morphology doesn't really affect it much. Yes. We can change it.
Yes, you
We can always change it.
But then, have you had some young people come over and over and over,
yes,
and you had to tell them to stop?
Yes. It's very easy to get addicted to cosmetic surgery. Very easy, because the results are fantastic. Let me tell you the results. Now, the results are these. Every time I do a beautiful cosmetic procedure for a patient, I see her in the next 1 year pregnant.
Oh!
I don't need to explain it. Do I need to explain myself? I don't need to. It's just clear. Every time you see she comes out beautiful, sleeky, fine, 1 year after pregnant.
But then some people become obsessed with that.
Yes, they become obsessed because she cries and said, look, I was so good, I was looking fine, this guy wouldn't allow me sleep, and now I'm pregnant. Then you hear something like, don't worry, I'm going to pay for it again. I just want you to look good. You know, cosmetic surgery rebuilds the family. It keeps the man in the house. It keeps the man's eyes on his wife and on his girl. Yeah, it makes sure that his hands are always on her. And that's what we want to see in the family. That his attention is always on her. His hand is always on her. But the danger about cosmetic surgery is that she ends up getting pregnant. And so she comes again for a second procedure. So I'm trying to stop.
Yes, very important.
More than one procedure, 2 procedures, 3 procedures maximum. By the time you get multiple procedures, you're having a stepping stone to complications.
I think people who've come for a procedure and then they have to follow a certain lifestyle, they've made a mistake and it has hurt the work done completely.
Obviously, obviously. I give you another A grade for that. After every cosmetic procedure, there is its lifestyle, especially when it comes to liposuction and fat transfer, fat filling. It comes to the patient has to live a certain type of lifestyle. My patients have this mistake they do, that liposuction is to control weight. So you give them this nice slicky shape. 2 years after you see them, oh, I'm sorry, I've been eating. No, you have to change your lifestyle. You have to maintain that weight. You have to do a lot of physical exercises. You have to do dieting. You have to monitor how you eat, how you live, in order to maintain that cosmetic shapes you are having. You don't need to do procedures and procedures and procedures. It's not necessary.
The doctor can only do as much.
Oh, yeah.
The rest is your responsibility. But the most important message today is just love yourself.
Yeah.
Love yourself. That's the key. Whatever he does could add on to it or not. Begin by loving yourself. Thank you so much, Dr. Oben.
Thank you.